What are symptoms of ADHD? Attention Deficit Hyperactivity Disorder, ADHD, is a neurodevelopmental condition that, according to the CDC, affects an estimated 11.3% of children and 6% of adults. While the disparity in numbers might suggest that people grow out of it, ADHD is a chronic condition, meaning it doesn't go away with age. So, why the disparity? The answer may lie partially in how ADHD symptoms can change with time. Hey there, Melissa Hummelt, LPCC here. Welcome back to the BetterHelp channel. Today, I'll be talking about ADHD causes, how ADHD symptoms show up in kids, teens, and adults, and how it can affect mental health at any age. Let's begin at the beginning. What are the causes of ADHD? The exact cause of ADHD is still unknown, but researchers believe it's a mix of genetics, brain structure, and environmental factors. Here's a quick breakdown. Genetics. ADHD tends to run in families. While there's no single ADHD gene, studies point to multiple genetic markers that may increase the likelihood. Brain structure and chemistry. People with ADHD often show differences in gray and white matter in overall brain volume. Neurotransmitters like dopamine and norepinephrine, important for focus and motivation, may also be lower. Environment. Things like prenatal exposure to alcohol or nicotine, childhood head injuries, or even certain pesticides may increase risk. Other factors. Premature birth, low birth weight, or extreme prenatal stress have also been linked to ADHD. Let's talk about the different types of ADHD because not everyone experiences it the same way. First, let's look at the inattentive type of ADHD. Struggles include focusing, organizing, and completing tasks. You might forget things easily or get distracted mid-task. Next, let's look at the hyperactive impulsive type. Lots of fidgeting, restlessness, blurting things out, or acting without thinking. Finally, there's the combined type of ADHD. This is the most common and includes symptoms from both categories. Now let's take a closer look at what ADHD symptoms can look like across different ages. ADHD in children. Symptoms usually appear before age 12, sometimes even as early as 3, but not all kids show the same behaviors. Here are some common signs. Short attention span and trouble following directions, losing things or being disorganized, fidgeting or having a hard time staying still, talking a lot, interrupting others, blurting out answers, and emotional outbursts or difficulty managing impulses. To get a diagnosis, symptoms must show up in at least 2 settings, like home and school, and significantly impact the child's ability to function. ADHD in teens. The teen years come with new pressures, and ADHD symptoms can make them even tougher. One challenge comes in the form of school struggles. Inattention, forgetfulness, and poor time management can affect academic performance. Another challenge can be social challenges. Difficulty understanding social cues or managing back and forth conversation can lead to isolation or conflict. Finally, there's the challenge of risky behavior. Teens with ADHD may be more likely to engage in behaviors like substance use or reckless driving, often tied to impulsivity. ADHD in adults. ADHD doesn't disappear in adulthood, it just shows up differently. At work, trouble prioritizing, meeting deadlines, or staying organized can cause career hurdles. Impulsivity, difficulty listening, or emotional intensity may strain relationships with partners, friends, or family. There can also be impacts on finances and responsibilities. Forgetting appointments, overspending, or missing bills can make adult life feel overwhelming. How ADHD symptoms can impact mental health at any age. From childhood to adulthood, ADHD symptoms can create situations that adversely impact mental health. In turn, mental health issues can exacerbate ADHD symptoms, creating a negative cycle. For example, inattention or disorganization can lead to missed deadlines, causing stress that leads to even worse focus. Repeated failure or criticism can damage self-esteem, leading to anxiety or depression. And struggling socially may lead to social anxiety, and impulsivity may drive substance use as a coping mechanism. According to a 2020 study from the National Institute of Mental Health, over 72% of people with ADHD had at least one co-occurring mental health condition, with depression being the most common. Such statistics highlight the importance of catching and treating ADHD as early as possible. Timely intervention can help boost a child's academic, social, and emotional well-being. Early treatment can help control symptom development. Prompt treatment may promote better coping skills, and early treatment may also reduce the likelihood of long-term challenges associated with ADHD. Professional assessment is critical for an accurate diagnosis, especially in young children. Normal childhood behaviors can be mistaken for ADHD symptoms and vice versa. Adults who self-diagnose run the risk of symptom mismanagement. In summary, sometimes the symptoms of ADHD are challenging, but people with ADHD can learn to manage them and lead balanced, joyful, and productive lives well into adulthood. If you suspect you or someone you love may have ADHD, a healthcare professional can offer an informed diagnosis and treatment plan. If you found this video helpful, give it a like and subscribe to our YouTube channel for more on mental health. Also, if you feel comfortable doing so, share your experiences and let us know how you cope with ADHD in the comments below. Thanks so much for watching, and see you next time.